Great. Okay, and so now that we are being recorded for people to listen to after the fact. But thank you for joining us today on this last day in March for the Shepler Fear weekly lunch update or webinar. Today's focus is going to be on a legislative update, and we're going to talk about both federal and state issues. And I thank you for joining me. And as I said, if you would please mute your phone. We will have time for Q&A at the end, and I will remind you to unmute your phone at that time. All right, so let's go ahead and get started. A little bit of background as to Shepler Fear and our commitment to all things legislative advocacy. We have been involved in government affairs for more than 25 years. We are actively members of the Association of Health Underwriters, the Self-Insurance Institute of America, and the Coalition for Business Healthcare Choices. So, you know, if there's a good cause, an association that, you know, represents our legislative interests, we try to be politically involved with them. We're big believers of that, and you know, many of you probably know us from our involvement on, you know, either the local, state, or national health underwriters that we are big believers in. Just so you know, between myself and my father, Dave Fear Sr., and even our, you know, one of the founding members of Shepler Fear, Rob Shepler, we've been all, you know, heavily involved in both the CAHU, NAHU as legislative chairs at one time or another. As many of you know, I am currently the legislative chair for CAHU, and I'm in my third year of doing that. Beyond that, we are members and leaders of the Business Coalition that has been very active in specifically for self-funding and HRA wraps and making sure that you know, we are getting legislation passed to further those two ends, provide witness and testimony for various legislative initiatives and measures. And actually on Monday, I will be in Sacramento providing a testimony on the new HSA bill that for California that I'll talk a little bit more about in a moment. And Dave Fear Sr. is the former chair of the NAHU Industry Relations Committee, as well as the NAIC representative. So, with a little idea as to why we feel that we can comment on these things, let's go ahead and get started on what exactly is going on. So right now, you know, many of us are looking at DC and waiting to see what is going to happen there. As I'm sure most of you are aware, the Republican group did put forth a bill called the American Health Care Act. And, you know, let's talk a little bit about what that would have done specifically, and the reason why I think it's still important to talk about it. So the AHCA would dismantle most of the ACA's taxes. It would eliminate the individual and employer mandate penalties. It would, however, continue to retain some of the protections about pre-existing conditions. It would retain the children's ability to stay on their parents' plans up until age 26, which are probably the two most popular features of the ACA. It would change how the federal government funds states' Medicaid program, which in California is Medi-Cal, to a block grant, a definitive amount of money instead of just an open purse. It would change the way that the advanced premium tax credits are paid. And rather than be based on how much you make and how much the plan costs, it would change it to a set dollar amount based on your age, between $2,000 and $4,000. And it would also expand and enhance the use of and the kind of features of health savings accounts. That's a big proponent and wanting to make those more attractive. However, this AHCA is part of the budget reconciliation process, which is a little bit different from the normal way of doing it. The budget reconciliation process can only deal with aspects of the ACA that had to do with money. It had to have a budgetary impact. And so that's why it is semi-limited on the things that it could mess with. And the reason why is that that bill would only require a 51 votes to pass through the United States Senate. Typically, with a normal bill, you'd have to get a simple majority of the House and a 60% of the senators. There are 52 Republican senators in the country, and if it goes through budget reconciliation, it would only need 51 votes. It is, because of the fact that they wanted to try to do this reconciliation, it could only go so far, and it couldn't actually do some of the other market reforms that the ACA did and that they would want to do. However, they were not able to get the votes through the House of Representatives. They needed 216 votes, and there are, I forget the exact number, but there's roughly 240 Republicans. But there was there was not a single Democrat that was willing to vote for this bill. And the Freedom Caucus, which makes up around 35 members, all said that they would not support it, and that meant that there was not the 216 votes. So this was tabled last Friday. Okay. However, even though the slide here shows a rest in peace on that, the reason why I'm still talking about it today is because this week there was movement again on it. They are trying to see if they can get the needed votes. And so I think it is important that we're still aware of that bill. You have to be aware of what source you're getting your information from, because whether it's MSNBC or Fox News, they can provide two wildly different narratives on whether or not that bill is completely dead or if it's going to come back. And from what we're hearing is that actually the AHCA is not completely dead, and they are still going to work on it. Okay, and so that's why, again, I presented that in our slides this week because I think you need to be aware of it. However, if that AHCA, the reconciliation process bill, does not happen, what the president has said is, okay, well then maybe we need to look at this another way and see if I can get Democrats involved. If that, the far-right Freedom Caucus doesn't want to do it this way, which we thought would be the easiest way to kind of help them fulfill their campaign promises, well then we can try it the other way. We can try to do more of an, get buy-in from Democrats and have this go through the normal process. Now whether or not we'll be able, the president and Speaker Ryan will be able to get Democrats to pony up to the table and work with them on ideas on how to fix it, we'll wait and see whether that's going to happen. But the other thing that President Trump had said is that if they're not willing to do the reconciliation bill and if Democrats aren't willing to come together at this point, he's perfectly okay with just letting it stay as is. In many states across the country, the Obamacare is not doing well. In some states, they're already calling it a death spiral. And so, in California, we're a little bit different. I would say that we're probably the most successful implementers of this law. But even here, the individual market, the IFP, individual family plans, is very much on the precipice of having major issues. And so, the president's stance on this is, well, if you guys aren't willing to do something now, then I can just let this go, and this is going to implode by itself. And then you Republicans are going to be in trouble because you didn't follow through on your campaign promise, and you Democrats are going to be in trouble because your signature piece of legislation is imploding. So it's an interesting strategy, and I guess I am under the belief that we will continue to work on this through the next several months. No, his big bully pulpit didn't necessarily work by putting that ultimatum down, but that does not mean that we are not going to still see something here in the next couple of months. Now, one thing that has been put forth by the U.S. Senate, two senators actually, one Republican and one Democrat, was let's craft legislation that basically says each state you figure it out yourself. If you want to keep the ACA, you can, or if you want to do something different, you can. And that is something that when we were in Washington, D.C. back in February had just been introduced and is getting some movement. Okay, but at the same time, this is unfortunately the United States Congress, and hoping and expecting these people to act like adults might be really asking too much of them. So in the meantime, things continue on as is. All the reporting requirements are still there. Technically the mandates, the penalties are still there. And so life continues on. So back in California, as I'm sure you all are aware, Democrats hold a 2/3 supermajority in both the Assembly and Senate, as well as having a governor who is a Democrat. Many folks here support a single-payer type system, and I'll talk about that specific bill in a moment. But they also are big believers and want to make the ACA work. They went full in, 100% committed to Obamacare, ACA, back in 2013 and 14. And they are really, especially the leadership, rather than throwing the towel on that and look at a single-payer solution, most of the Democratic leadership still want to make the ACA work if they can. And so one of the things they're going to try to do is just ask for exemptions and say, if you guys want to do something else in the country, you can, but let us make what we have done work. And one of the, so as we can read there, California, the two biggest things that they're really concerned about, that they need the Fed's help on, is the money aspect, specifically for Medicaid, which is Medi-Cal, and those advanced premium tax credits that help pay for people's plans who buy through Covered California on the individual market. And there's not a whole lot, everything else they can do and keep with the ACA here in California, but those are the two things that they need the Fed's money for. Okay? And so that's why you've seen several bills introduced in California that are currently spot bills. Now, for those who don't understand what that word means, spot bills is essentially the legislators have to introduce all their legislation for the year by a certain date. And that date is the end, I forget what day it was, but it was the end of February. And a lot of times they might not have fully a bill crafted by that due date, but they still have to have basically a placeholder into that can be reviewed and everything else. And so a lot of times what they will do is they will introduce a bill that it will be assigned a number, and it is very vague. It'll say, the intent of this bill is to do such and such without any other details, and that's called a spot bill. Okay? And there were 4 big spot bills that were introduced that, as they stand right now, don't have anything in them. But the reason why we have them up on the board there, AB 156, 157, and SB 133 and 134 are spot bills introduced by the committee chairs of the health committees for both the Assembly and Senate. And two of the bills have to do with how they want to reform the individual marketplace, and the other two are wanting to reform the small group marketplace. So while there's nothing in these bills just quite yet, they're essentially placeholders for the Democrats with the power to then, depending on what happens from the federal side, to craft legislation here in California. So we are watching these bills to see how they are amended, and those amendments actually do need to come here within about the next month to see so that they can move through their respective committees. There were several bills that we need to be aware of right now that were introduced and have some language. The big one is SB 562, which would institute a single-payer system. Okay, you will hear a lot more about this, especially from CAHU, in the coming weeks. But for a lot of that bill right now is more vague. And the big thing that they are leaving out of it is how are they going to pay for it. They did just amend the bill somewhat yesterday to talk a little bit more about how they envision single payer to function in the state of California. But again, the big piece that's missing from it is how are you going to pay for it. And for those who were paying attention to what happened in Colorado, Colorado tried to offer a single-payer system in their last election, and that bill was actually, when it was first introduced to Coloradans, it was something like a 2/3 supported it, with only about a third not supporting it. And then when they explained how they would pay for single-payer in Colorado, that bill ended up losing 80% saying no to only 20% saying yes when they decided to explain to Coloradans how much that would cost them. So, I would expect you'll see there's a reason why in California they're trying to go as far as they can without explaining how to pay for it. Other bills, very quickly, that I'll just talk on, have to deal with acquisitions and mergers. They do not want the insurance companies to consolidate, and so this bill would make it more difficult for them to do that. The bill that I'm going to testify on Monday is an HSA tax conformity bill. I'll talk about this real quickly here. As you are probably aware, if you put money into an HSA account, that is a write-off for your federal taxes, but not for your state taxes in California. Every year for probably the last 7 to 8 years, there has been a bill introduced in California that says that it would mirror what the federals do, and the dollars put into an HSA account would not be taxed on the state level. So no big deal there that it's being introduced again, but what is different is this is the first time ever it's been introduced by a Democrat. Jim Cooper is a Democrat in the Sacramento area. He's a moderate guy, and he is introducing this, and it is actually getting some support from other Democrats. And so we're kind of, and that's the reason I'm going to go and testify on this, is we think this might get a little bit further than it has in the past. And actually, the head of the Finance Committee, where this needs to start with, actually signed on as a co-author, so we might see some movement finally on this. There's another bill by Senator Ed Hernandez, who is, if you are aware, is not a big fan of any type of self-funding, and has been quite a bane for all us agents who like to self-fund by some of the legislation he has introduced. And this particular one is going to require that people who self-fund report information into the state government, which we never think is a great idea. There's also a bill that has to do with grandfathering, and I'm going to kind of skip over that one because actually we might have already gotten that bill amended to the point where it's not even going to be an issue. Like I had said, you know, the problem with single payer in this state is the fact that you have, you know, the nurses unions and some of the other idealists who really like single payer and think it'll fix all of our issues. And then you have the leadership who have to deal with the implementation and the cost. And so, you know, even though we're looking at a single payer bill again this year, chances are that it won't end up getting signed into law. That doesn't mean we don't still use that opportunity to explain why single payer isn't the answer. Because of Jerry Brown, who probably won't be big on the financial aspect of this. However, the Gavin Newsom, who has thrown his hat in the ring to be our governor in 2018, has come out saying that he would support this bill, which is concerning. And again, the reason why you're going to see a full-on blitz by the California agents to try to explain to both legislators and the general public why this isn't a good idea. And so, you know, you should expect to see more information coming out from especially CAHU, who will be leading the charge on this, on asking your help to defeat single payer. So before I wrap this up and open it up to Q&A, I just want you to know that you know, NAHU and CAHU both operate excellent grassroots programs. Both of them try to be nonpartisan, even though a lot of the members might be R's rather than D's. They try to provide testimony and sources that will work with both sides. And so we look to CAHU and NAHU on both federal and state things to kind of lead the way for us agents. And I would encourage you, especially as the ledge chair for CAHU, that when the association asks for your help on things, whether it's an email to your legislator or knocking on their door or sending a letter, that you do so. You know, that's the power that we have is when agents and brokers band together to deliver a message to legislators. If we talk loud enough, that's how we get stuff done. Please be aware that you'll see e-blasts come out as they're appropriate. We try not to ask you to chime in on legislative issues unless we think it's important. And for those of you who are not NAHU members, I would very much encourage you to do so, as you know, it takes money to run these legislative advocacy groups, and you're needed. So with that, I will open it up for Q&A. If anybody wants to ask for some specific issues on either federal or state, I'll do my best to answer them. Reminder to you that you probably muted yourself, so go ahead and unmute yourself if you'd like to ask a question.
Dave?
Yes.
Glenn here. Just with regard to federal side, appreciate everything you described there, but would you say that whether ACA is repealed or not, whichever system it ends up with, that fully insured plans are still going to be expensive and that HRAs and self-insuring would have great value?
Yes, I would say that. I mean, we're big believers in the fact that whether it's level funding, self-funding, or HRAs, they're a great opportunity for employers of all sizes to lower their costs. You know, and that's kind of, as many of you know in the webinar last week, that's where we hang our hat. And I don't see anything as it currently stands, or even as the proposals that are coming from the federal government that would discourage HRAs or level funding or self-funding. In many ways, I would only expect to see things that are going to be better for those types of products.
Yeah, could encourage it even more if rates keep going up. Yeah.
Yes, correct. Any other questions? Well, if there are not any other questions, we can go ahead and sign off, and you can finish eating your lunch in peace. I will add one thing, just because somebody should have asked this, and that is, I said earlier that the ACA will continue to go as is with their the penalties and the mandates. And somebody should ask, well, what about the executive order that President Trump did, essentially trying to get rid of the individual mandate? Well, he can't get rid of the individual mandate, okay? That is still there. What his executive order did was it told the IRS essentially that I don't want you guys focusing and spending a lot of time on confirming whether or not people actually have insurance when they say they did. Okay, and that's about the extent of the power that he can without actually introducing that legislation. So just be aware of that when you have clients and consumers ask you that he didn't actually repeal the individual or employer mandates, only that when somebody's doing their taxes and they said, yes, I have insurance, that he's telling the IRS, I want you guys to not follow up and ask questions on that. Okay, that does not mean that your tax preparer or CPA isn't going to still assess that penalty as they're kind of supposed to. All right, so those mandates are still there. Any other questions before I sign off? I'll give it a few seconds here. Okay. Well, I appreciate your time. I look forward to the opportunity that we have to show you the different products that were mentioned. HRAs, level funding, self-funding. I think they have a great future still. I see no reason to think that they're going to go away. And I appreciate the fact that you look towards us for legislative information, and we will continue to lead the way with by providing that information to you. And with that, I wish you all a happy Friday, and hope that you enjoy your weekend. Take care.